I mean, if you go to the doctor and say, I think I've got some set of symptoms, generally speaking, they don't say, well, where do you think that came from? Was that something in your genes? Was that something in your environment, or some interplay between the two? What they tend to do is focus on the symptoms. But in this world, we kind of don't do that. We get hung up on what might have caused it initially.
Welcome to All Aboard, where we help parents navigate the ADHD journey. I'm Claire, and today we're joined by expert guest Dr. Mark Kennedy. We'll be discussing the link between early adversity and ADHD in adopted children. Dr. Mark is a senior lecturer, programme lead, and a researcher on the English and Romanian adoptees study at King's College London. His PhD focused on modern applications of attachment theory, and his postdoctoral work has focused on the developmental outcomes of extreme early adversity, including ADHD, neurodevelopmental disorders, attachment and mental health. Mark is also the author of the King's College London Understanding ADHD, Current Research and Practice, massive online open course accredited by the CPD, which you can undertake for free to learn more about ADHD, including symptoms, the latest research and treatment. So far, over 114,000 people have enrolled for the course, designed to help change attitudes around ADHD. Welcome aboard, Mark.
Hello, glad to be here.
Thank you for joining us. Today, we're going to be discussing quite a complicated subject because there seems to be such a big disconnect, from what I can understand, between research and practice with adopted children. So I'd like to start by asking you, if we start at the beginning, how often do adopted children with ADHD get wrongly diagnosed, not diagnosed enough, or perhaps not even diagnosed at all?
It's a really, really good question. And the answer is, I don't think anybody really knows, to be certain. So you've got people like, say, for instance, Matt Wolgar, colleague here at King's as well. And he is a clinician who's very, very interested in this topic. And what you find when you look at the evidence in terms of what people are referred for, and then what the clinician actually thinks that person has. I mean, that's kind of the best way we've got at getting at this question. You find a massive, massive over-referral for things like attachment difficulties, and a massive under-referral for particularly things like ADHD. That's really the crux of this gap between the evidence base and practice, is that when you look at our work, the work of the English and Romanian adoptees study, we find, and that's obviously a different cohort who had very particular experiences in life, we find that between sort of 20-30% meet criteria for ADHD. And that's obviously very, very high relative to 5%, which is what you'd expect to find by chance. And interestingly, when you look at those other studies that have looked at the referrals versus that figure's probably not too different from what you see in those kinds of studies, actually. But instead, they seem to get referrals for things like attachment difficulties. And when you look at our most recent work, as soon as people mention that they have this background of being adopted or care experienced, that's when these kind of, I guess you'd call them heuristics, that kind of come into play, and people start thinking more about attachment and less about things like ADHD, and also it's true of things like autism too.
Okay, it's interesting. So I was going to ask you why that happens. So from what I understand from what you're saying, is it almost a presumption because they understand, right, okay, this is an adopted child, therefore let's look over here first, and they ignore perhaps what the symptoms are suggesting that perhaps could line up with something like ADHD or another neurodevelopmental disorder.
So yeah, you basically find in primary care that there are certain assumptions that get made. So, if you look at like the Understanding ADHD course that we have here at King's, the public move, one of the things that Catherine says is you hear things like, well, you don't look like somebody with ADHD. And then in other areas of health, you've got young women sadly passing away of cancers that just weren't detected because people didn't include in their assumptions that's a possible outcome. There seems to be some sort of equivalent with people who've care experienced or adopted fostered, and that is what's likely, basically. And the assumption is that it's attachment based, and unfortunately, there's not really much evidence for that when you look at it. But I guess a lot of this is historical. So if you look at like the really, really old studies that looked at the sorts of difficulties that care experienced people have, they're kind of from the 80s and the 90s, and they didn't really include people who'd had any kind of adverse experiences, not of the sort that we've seen in more recent cohorts. And what they found broadly was that you've got early bond forming difficulties, and then later issues with identity. And that's absolutely formed the way that primary care looks like. So adoption support workers, care workers, social workers, even the Adoption Support Fund itself, very, very much focused on those. But more recently, I say more recently, we're talking kind of since probably the mid to late 90s onwards, so not that recent, we've learned that actually there's more to it than that. And that kids who have this history of particularly things like institutional deprivation, which is what we've focused on, have much, much higher likelihood of having ADHD than people without those experiences. But the care pathways don't seem to have caught up with that.
So how does overlooking ADHD because of these other assumed issues, you mentioned attachment, how does that affect how we understand the behavioural needs of adopted children, and what problems does that cause?
Yeah, so this is kind of one of the $1 million questions, really. And we've looked at this in a couple of ways over the years, and one of which was a paper that we published back in 2016. And what it was doing was looking at the adult outcomes of these kids that had these difficulties that looked like ADHD in childhood. And what we found were really, really very high rates of problems in later life. So the rates of unemployment were about 88%, and the baseline comparison was about 12%. And that's a big increase. And also things like higher rates of mental health problems, lower rates of educational attainment, and also, and I think importantly, lower rates of self-rated quality of life. Obviously, alongside that, and that's really why we, one of the reasons why we did this later qualitative work, and it was to look at this is a group of people who have been adopted into incredibly warm, loving families, incredibly stable families, well-resourced families that have sought help over the years, and nevertheless, you see these poorer outcomes. So that's kind of an important question, right? Why is that? And what we find is that there really does seem to be this lack of awareness that these kinds of early experiences are related to not only these kind of neurodevelopmental conditions that we see, but also that it affects brain development, which is unusual, really, because we've known that for decades. That's a really, really well-established finding in this field. And you can see that these problems that people have are mediated by the way that people's brains are affected. I mean, I guess I should say, though, because obviously it sounds really scary, doesn't it, when you say it like that? A lot of it's all very relative, of course. So when you speak to the families themselves, these are people who have gone on to live very, very happy lives in the main, whose parents are, loving, warm families. And even then, around half of the group, even in the most deprived group in our study, don't have any of these difficulties. And I think that's quite an important thing to highlight, because what you don't want to say is because you have these earlier problems in life, you're destined to have these poor outcomes. It's absolutely not the case. And equally, it shouldn't be assumed that because somebody has had these difficulties in early life, that they will have these problems, because the evidence just doesn't support that. But what the evidence does say is where these problems are there, and they're really apparent in our study, at least from around about the age of 6, and you find some improvement over time, but really only until kind of early adolescence. Things are really, really stable from adolescence onward. And if these problems are there, they're probably not getting the help that they need. And that, unfortunately, is quite kind of a negative thing to say, but it is what it is. And it's not just us that found this. Like I said, you look at the work of Matt Woolgar, you look at the work of Jonathan Green up in Manchester, and they paint the same picture, unfortunately.
So what can be done to bridge that gap then? Because, if I think, obviously my son is not adopted, but he was diagnosed at 6. And from my experience parenting, that with the child with ADHD, those are some really crucial years that actually I'm very grateful that he was diagnosed relatively young, because it meant that I was able to support him and the way he developed during that time in a way that I wouldn't have been able to without the diagnosis. So what can we do to help bridge that gap to ensure that adopted children with ADHD get the right help and support that they need from everyone involved at a young age?
It's a really, really good question. And obviously all the evidence suggests that early intervention is preferable. But any intervention is better than no intervention. So even if, things aren't picked up on early, it's better to intervene at some point later. There are a couple of kind of elephants in the room. One of them is that there is one randomized control trial on this topic called the Bucharest Early Intervention Project, but our study isn't randomized. So there are people who would question whether this is a causal relationship. I haven't seen any alternative explanation put forward that would explain it in my mind. And also you look at people like Jesse Baldwin's work published last year that addressed this exact question. And so whether the deprivation or the maltreatment caused some of these symptoms, or whether it's the symptoms that drive, by some gene environment correlation, let's say. And I think Jesse's work has been quite pivotal in unpacking that. And what it shows is that people who are care experienced, or people who have adverse experience in life, are at an increased genetic risk, which is probably wouldn't be a massive shock. But also that genetic risk doesn't explain all of it, which suggests that there is that causal component too. And I think people get quite hung up on that. I don't really understand why. But if you go to the doctor and say, I think I've got some set of symptoms, generally speaking, they don't say, well, where do you think that came from? Was that something in your genes? Was that something in your environment, or some interplay between the two? What they tend to do is focus on the symptoms. But in this world, we kind of don't do that. We get hung up on what might have caused it initially. And then there's this second issue, which is the, confusing it perhaps for something like attachment difficulties. I guess in terms of what parents can do, the thing is when you speak to parents in this world, they'll say, we're the ones that we noticed that something wasn't quite right, and we keep going to get help, and we're hearing lots about attachment, we're hearing lots about these other things, but we're not really hearing very much about ADHD. So I think it's largely up to practitioners to kind of acknowledge the evidence base. And there's a few really important things there. One is that ADHD is clearly elevated in looked after groups. It just is. All the evidence suggests that. At the same time, it seems to be under-recognized. And I guess to probably not make too many assumptions, basically. Our research sort of suggests that it's obviously complicated because there's this set of assumptions come in that don't seem to come in elsewhere. But at the same time, it might actually be more straightforward, that if somebody's in front of you saying, I'm primarily inattentive, I struggle to remember where things are, and I forget things and all that sort of stuff, that at least entertain the notion that it could be ADHD. What we've kind of advocated for is things like more use of screeners. There are well-developed screeners for things like ADHD out there, that aren't widely used, and actually it probably makes sense to do that. And parents can access them themselves, although obviously it's not a diagnosis, it's a screener.
So I guess what you're saying is that, parents, if they feel that people are perhaps turning a blind eye to the symptoms that they're seeing within their child and that they're trying to communicate, if people just aren't listening because their attention is very much focused on the fact that these children have had a tough start in life rather than looking at what they're presenting in that moment, that you would suggest that they start by actually, it's not quite taking the matter into their own hands, but I guess trying to build some evidence because I'd imagine it's a fight enough for us, right? But I guess from what you're saying is it's almost an even bigger fight for the parents of adopted children to get people to listen and to help. Is that what you would recommend?
Yeah. And I suppose just introducing a broader vocabulary to the parents. So, if you are thinking, I've got a child who's quite bright, but is really struggling in certain areas, there might be a name for that. And if the parents come across those names, then at least they can say, well, is it this? Is it that? And just kind of raise that awareness. And that's one of the reasons we developed the ADHD course and made it free, so that people could, go, well, actually, that does look a little bit like what I'm seeing. Again, you don't want to self-diagnose or that sort of stuff, but it can help point people in the right directions, I guess.
Yeah, I was going to mention your course actually, because that's how I very first came across you, and it was hugely valuable in my own learning and understanding, and the foundation for everything I've gone on to learn and advocate for my son when it comes to ADHD. And it's one that I recommend to so many people. So it feels like this is probably a good opportunity to maybe just talk a little bit more about that, because I think it is a really great starting point for people if they want to lay some of the foundations. So what does the course cover? It's obviously free. People can sign up for it. How would it help people?
Yeah. So it's called Understanding ADHD. And it's run by a collaboration between King's and Fuchsia Learn. And so basically the way that we designed the course, or the reason we designed the course, was basically if it's quite easy to find bad information about ADHD, quite easy to find the myths. And it's really, really easy to find people just saying, I don't believe in ADHD, I don't think it exists, all that sort of stuff. We see that quite commonly. And you sort of, maybe there's this view in academia that you throw your papers out into the world, and it's up to people themselves to to learn from that. But actually, it's not very easy to find good information on a lot of topics that's digestible. It's all in one place, and that it's been curated well. So that's kind of why we designed the course in that way. So it covers, things like why we use terms like disorder. What do we mean by that? What do we mean by symptoms? A large focus is on the lived experience of ADHD, which is really important. And we address a couple of the sort of tougher issues. I mean, one of them is that the evidence-based treatments are stimulant medication and non-stimulant medication, but nevertheless medication-based. We talk about why that is from a kind of evidence-based perspective. We talk about the pros and cons of that approach, but also we talk about the non-pharmaceutical options, and option might not be the right word, but the interventions that are out there, why those interventions exist and what role they might play. We tried to make it as comprehensive as possible, and I'm glad to hear that it's helping people.
Massively so. I recommend it to lots of different people, and I think in some ways many of the reasons why you wrote that course is the reasons that I wanted to start this podcast, because I feel as a parent who's been on this journey myself and has gone on to support other parents that there is a lack of credible information that can be a really good accessible starting point for parents that are new to this journey. Because I think you want, and what I'm trying to achieve with All Aboard is to give people a resource and a place to start where they're going to get trustworthy information. They're going to hear the stories of other parents, which is the lived experience that you talk about, and to help them feel less alone on that journey as they kind of arm themselves with the information that they need. And obviously going back to the conversation that we're having, particularly around adopted children, you cover that as well, don't you, in the course?
Yeah. So that's part of it. I mean, in a sense, it's so. I mean, my PhD was in attachment theory, and then I came into this study. Obviously, we have ADHD as one of the core outcomes. So coming at it from that perspective, it's always struck me as a little bit odd that there are these. I mean, what would you call them? Kind of areas of disagreement, or whatever you want to call them, around ADHD. Because essentially, it's you're oversimplifying, of course, but some people struggle with attention, some people struggle with hyperactivity, impulsivity, some people struggle with both of those things. And on the face of it, that doesn't seem particularly controversial, really, and yet it is for possibly a whole host of reasons. But I think one of the things that we want to make clear in that course as well is that, and this mostly applies to childhood, less so to adulthood, is that ADHD is the most neuroimaged condition. And there is a mass of evidence on the neuroanatomy of ADHD and also the genetics. Now there are, with a couple of recent good GWAS studies. And I think once you show people the biological evidence, the sort of hard evidence, if that's what you want to call it, people kind of go, oh, I accept it. It's a real thing. Which as a psychologist, that's not generally how we think, because if people behave differently, clearly that's something, in the brain, right? That's people have a consistent way, different ways of engaging, because what else could it be? So it's a strange one. I mean, I've always found it fascinating, partly for that reason that there are these kinds of myths and all that sort of stuff around the condition.
Yeah, I think from my experience, it's hugely stigmatized, and something that I work really, really hard to advocate for and raise better awareness for. And I think that's hard enough. But if you're then dealing with children who are already perhaps disadvantaged because of the start that they've had in life, it's quite heartbreaking that then what is already difficult enough for parents when they're trying to get people to pay attention to a set of symptoms or take something really seriously, which can be hugely impairing for a child, that they then have to fight even harder because of the fact that they have had early adversity, that they have been adopted, that people are then not taking that seriously either. And obviously all parents with children with ADHD need that help and support, but particularly those that are fighting so hard on behalf of these children. So what one piece of advice would you give adoptive parents listening to this today that could help them on their journey?
I think probably the fact that you're not alone. The evidence suggests that, like I say, ADHD is elevated in care experience groups, and that, well, so you look at and it's qualitative, it's small samples, there are all those sorts of caveats with it. But I think there's some suggestion of hope in there too, that when you talk to people in our group about those who have overcome the hurdles and they've managed to get the right sort of support, and by the right sort of support, I mean the support that, NICE guidelines map onto the condition, they do say that it worked and it helped. Obviously, alongside that, particularly with ADHD medication, you get people talking about the negatives of taking medication and side effects and those sorts of things. But in the main, what people say is that when they were able to get help, it did help. But it wasn't easy getting there. And so I guess, what I would say to an adoptive parent is you're probably going to have to advocate quite strongly. But the evidence is all out there. Like I said, I mean, our studies, similar studies, Jesse Baldwin's study, Matt Woolgar's work. Matt Woolgar's published extensively on this. You just stick Matt Woolgar into Google Scholar and you'll find all of his work there, and our work, very easily too. And just kind of have a read through it. If you've got a child, I mean, I was talking to adoptive parents maybe a week or so ago that were saying this is the first time they've ever even heard of the fact that ADHD is elevated. And it's not the only thing that's elevated. There are other things too, but obviously we're mostly here to talk about ADHD. And that alone, knowing that, well, hold on, there might be a name for this. And if there's a name for it, then there might be some evidence-based treatment or support options, management options, that sort of stuff. I suppose be hopeful, I think, would be the other thing, because like I said, it's a suggestion, it's not, we're not talking about a collection of randomized controlled trials that have been meta-analyzed. We're talking about a suggestion, and it is that. But nevertheless, it's a hopeful suggestion as far as I can see.
Hope, I think, is such a nice way to finish that, because, this stuff can be quite heavy and it's very hard to be living with and advocating and fighting for all the time. But I think there's so much value in having this conversation to help raise awareness of the issue. It's something that I was very interested in from having done the King's College Understanding ADHD course. But actually, once I started discussing this with you in more detail, I just had no idea how much harder it was for parents and children in that system to have their ADHD even acknowledged as a possibility. So thank you, Mark, for sharing your time and expertise with us today. Because whilst this is a very complicated issue at its heart, it's also quite a simple one, because it's about helping children who have suffered so much already. And I guess helping parents to when they're fighting for their kids to have the confidence to say that history of adversity doesn't override the possibility of ADHD or any neurodiversity. So I really hope that our conversation helps adoptive parents kind of push to ensure that that isn't overlooked if they think it's something that's applicable to their children. So thank you.
Good. I think that's such an important point. There are so many areas of complexity to this. Once you start getting into the brain imaging data, the genetics data, the ways in which genes and environment correlate and how that's relevant here, there's so much complexity. But at the same time, when you look at, you look at the qualitative work recently, and it's probably more simple than any of that. It's just if you've got somebody who's displaying a certain set of symptoms, don't rule them in or out based on these kind of assumptions that are made. That's kind of what we should be doing anyway. And again, I understand why people don't, because, time pressures and all that sort of stuff. But actually, just by listening to parents, and particularly adoptive parents, then we can probably help.
Absolutely. Well, thank you so much, Mark. I really do hope that this has been helpful to parents listening. Thank you for your time. Thank you for sharing your expertise with us today.
No, happy to be here. Thank you very much for inviting me.
If you'd like to read Dr. Mark's work in the field of early adversity and ADHD, or you'd like to undertake the free King's College London Understanding ADHD course written and presented by Mark, then please do check out our show notes below for links along with more information. And if you enjoyed this episode and found it helpful, please can you follow and review All Aboard to help other parents find this podcast and welcome them aboard our journey too. Thank you for listening to All Aboard.